Hello, Swasti Charan sir. Good afternoon.
Good afternoon, Surya sir.
Good afternoon, Anilji.
Sir, shall we start?
Yes, please. If other dignitaries of the inaugural have joined, we can start.
Okay, sir. Okay. ठीक है. So I think our all the inaugural session dignitaries have joined us. So we are about to start our webinar. So a very good afternoon to all the distinguished dignitaries, panelists, and the participants who have joined us in this webinar. I am Anil Kathet, Junior Consultant, Center for Hill Area Development, GMR Division, NIDM. And I welcome you all in today's webinar on COVID-19 pandemic response and management in India. That is jointly organized by National Institute of Disaster Management, Ministry of Home Affairs, Government of India, and National Center for Disease Control, Directorate General of Health Services, Ministry of Health and Family Welfare, Government of India, and US Center for Disease Control and Prevention, CDC, Country Office, India. This webinar is actually a part of 12 webinar series on public health emergency and disaster management during and beyond COVID-19. building resilient workforce system and infrastructure in India. As you know, the world was gripped by COVID-19 pandemic, and new variant have evolved, posing a variety of challenges. And even the strongest economies of the world have had to deal with hardships. And since the very first COVID-19 case in Kerala, January 2020, India has persistently taken proactive measures to combat the COVID-19 pandemic, boosting the health system capacities to handle all the elements of COVID-19 management. And India also managed to maintain lowest positivity and mortality rate, coupled with one of the highest recovery rates globally during this COVID-19 pandemic, and all the research and development capacity in generating COVID-19 vaccine. It added the country's public health efforts. So today's webinar, it is all about uncovering all the response and management of COVID-19 in India. And for that, we have galaxy of experts with us who will be sharing their expertise, sharing their experience with us during inaugural session as well as during the technical session. And for the inaugural session of this webinar, we have joined by Professor Surya Prakash, Head GMR and CBRN Division NIDM, Ministry of Home Affairs, Government of India, and Dr. Meghna Desai, Country Director, CDC, Country Office, India, and Dr. Sujit K. Singh, who is Director, National Center for Disease Control, Government of India. And this is to also inform to all that Dr. Sunil Kumar, who is DG HS, Government of India, and Shri Taj Hassan, IPS Executive Director, NIDM. They both were also supposed to join us, but due to some unavoidable assignment, both are not able to be a part of this gathering. So both of them have shared their best wishes for this event. So now, without any further ado, I would like to pass the mic to Professor Surya Prakash, Head GMR Division, CBRN Division, NIDM, and request sir to kindly set the ambience of this webinar through his address. So with these words, the floor is yours, sir.
Thank you, Anilji. Good afternoon to all the dignitaries in the inaugural program, and also the distinguished experts of today's program, delegates and the participants. I welcome you all on behalf of National Institute of Disaster Management, Ministry of Home Affairs, as well as on my personal behalf and the organizing team. We are very happy that we joined hands with the CDC India and CDC, Ministry of Health and Family Welfare, along with other stakeholders to conduct this program. A series of programs has been chalked out. 12 programs have been discussed and finalized under the broad theme of pandemics, public health emergencies, and disaster management. Now, since the extreme events are also taking place in terms of climate changes, I think that we also need to cover aspects of climate change adaptation as well. Because today morning we had one webinar focusing on the heat waves and the health perspectives, which brought our attention to this theme as well. That not only the COVID, which has actually overridden over all other issues in the current situations, we also need attention to other hazards as well, which also include the natural hazards like cyclones, floods, landslides, and other type of disasters. So therefore, as part of our national policy on disaster management, we have been dealing in a multi-hazard perspective with cross-sectoral approach and transdisciplinary approach. That's why all the experts from different fields, they have joined hands together, and they will be discussing the different perspectives, which will help us to integrate all the views and dimensions of disaster management and get a holistic idea about the existing situations and the potential solutions. And the COVID-19 situations, as my colleague Anilji told, we came to know about it way back in December 2019, when some of the cases were being reported from the Wuhan city of China. And later on 22nd January 2020, the WHO from China office actually released its first report about the occurrence of these pandemics. Later on, the cases were reported even from India and other countries, and casualties started happening on a mass level. And the first wave followed by second wave with the different varieties and types of the coronavirus species, with alpha, beta, gamma, or later on in December 2021, we had also come across a new variant of concern called Omicron, which also had subvariants as well. So these have been going on till the February 2022, when the disease was getting spread from human to human. A lot of efforts were made by our government in terms of lockdowns, in terms of containment measures, and also the campaign, which was actually launched by none other than the Honorable Prime Minister of India in terms of COVID appropriate behavior and the 3 golden rules. He started with testing, tracking, and tracing of the COVID-19 cases, along with January 2021, when we have come to release the vaccine, the Tika. So the 4 Ts had actually become the buzzwords during the COVID-19 period: tracing, tracking, testing, and Tika. So these were the main things. But now in March, the cases have reduced to quite an acceptable rate. So therefore, the restrictions which were imposed during the COVID-19 period in the pandemic, they were eased down and ended up in many parts of the country. And also, most of the activities and sectors, they have been opened up. Now, in this particular series, we wanted to take up those cases, that what is the scenario, likely scenario, and steps to be taken up in the post COVID, beyond COVID situation. That now we cannot say still post-COVID, because many of the other countries, they are still reporting cases being risen due to this coronavirus. Some of these reports have come from South Korea, China, Hong Kong, and other countries. So naturally, we have to be careful and cautious in containing this disease, and also taking up steps for COVID appropriate behavior in the new lifestyle and work styles in our workforces, in our systems, and also in our infrastructure and services. So we need to consider all these events together, be it pandemics or any public health emergencies or climate change related health issues or disaster management related. So until and unless all are being dealt together to ensure safety and protection of human lives, as well as economy, environment, and all other such entities which are vital for our coexistence. So therefore, I welcome all the distinguished experts for accepting our invitation and ready to share the rich knowledge, experience, ideas, and innovations about disaster risk reduction and resilience, particularly with focus on pandemics and public health emergencies. So thank you very much. I think I wish all the best to everyone, and thank you for providing me this opportunity. We'll discuss it further in the subsequent session. So thank you very much, and wish all the safe, healthy, and good quality life on equitable, justifiable, and right-based manner with good fraternity. Thank you very much, Anilji. Back to you.
Thank you very much, sir, for setting the context of this webinar with your wisdom words. So moving further to further enrich the knowledge of the participant and all the gathering, we have with us Dr. Meghna Desai, who is Country Director of CDC Country Office, India. Over to you, ma'am.
Good afternoon, everyone. Thank you again for this invitation. So, Professor Surya Prakashji, as well as Dr. Swasti Charan, and Dr. Himanshu, Dr. Rajiv, and all distinguished panelists, coordinators, and attendees of this weekly webinar series. I'm really incredibly happy to be a part of this collaborative weekly webinar series that's been put together by the National Institute for Disaster Management, the National Centers for Disease Control, and the US CDC India office, which is obviously very timely to enhance the capacity of stakeholders engaged in public health emergency management and disaster management more specifically, especially as we cope with the management of COVID-19 in India. I do want to thank the leadership of both NIDM and NCDC for their collaboration with us on this activity. I'd like to highlight just some of the ongoing collaborative efforts with the Government of India that we have undertaken, including those with the National Centers for Disease Control, the National Institute for Disaster Management, the All India Institute for Medical Sciences in New Delhi, and the National Institute of Epidemiology with ICMR in Chennai on public health capacity building through our technical support. The US CDC country office in India provides support also to the states in developing the public health emergency operations centers and the capacities for what we call the Public Health Emergency Management, or FEM, Professional Development Program. The FEM Fellowship is a model that was created at the US CDC headquarters in Atlanta and has benefited a number of Indian experts over time. And currently a similar fellowship program is being planned for India as well. And so the NCDC and CDC collaboration on public health capacity building and response through the establishment of field public health emergency operations centers was really done during a number of Kumbh Mela supports, but specifically related to the Haridwar Kumbh Mela in 2021, which was really a vital step that was taken forward during the pandemic. And consequently, the state in Uttarakhand requested that a permanent FIOC be developed in the state, and both institutions are now currently supporting the FIOC development in Dehradun. And this support will include not only FIOC development, but also FEM capacity building and piloting of the Community Emergency Management Team and Community Emergency Response Team framework. CDC's technical support is also being provided for the development of public health emergency operations centers at NCDC and states or union territories, and public health emergency management capacity development as has been specified or envisioned under the implementation of the Honorable Prime Minister's Ayushman Bharat Health Infrastructure Mission. And also, as outlined more recently in the last Indo-US Health Dialogue held in 2021, following our Memorandum of Understanding on Pandemic Preparedness between the Ministries of Health of the two countries. I would like to also mention that the NCDC-CDC collaboration, together with WHO's collaborative efforts, have led to an online self-learning short course on the Rapid Response Team training package for rapid capacity building of RRTs. The training package was actually made available on the WHO Global website in June of last year. And since then, over 5,000 participants from 137 countries have benefited from this course. I appreciate the director of NCDC, who had requested the surveillance officers from all states and union territories in India to undergo this online RRT training to develop their response capacities in the context of COVID-19 response. Also, in line with the CDC's global and as well as WHO's incident management system modules that have been targeted towards enhancing the capacity of public health responders and augmenting the ongoing COVID-19 response, a 5-day foundational incident management system, or FIMS, training package is also being adopted to the Indian context at this time. So, this is just a glimpse of all of the different types of work that we have been very fortunate and privileged to support Government of India with, and very grateful for the collaboration to date. And I really do want to thank the stakeholders for allowing the participants today to attend this series. I'm certain that the participants will benefit from this weekly webinar series. And I also want to thank the speakers for not only giving their valuable time, but more importantly, their valuable knowledge to this platform. And once again, I'd like to thank NCDC and NIDM for hosting this important and very timely capacity building program. Thank you.
Thank you very much, ma'am, for enlightening our participant on the theme of the webinar, as well as providing insights on the initiatives of your organization that have been against the COVID-19 response in India. So once again, thank you very much, ma'am, for joining us. So now for the inaugural address, we are fortunate to have with us Dr. Sujit K. Singh, who is Director, National Center for Disease Control, Government of India. So with this word, I pass on the stage to you, sir. Over to you, sir.
Thank you very much, Dr. Anil, and a very good afternoon to all the experts and all the delegates who have joined virtually in this important initiative of web series, wherein the primary focus will be on the pandemic preparedness in view of the currently ongoing pandemic of COVID-19, and also to develop a futuristic approach regarding the public health emergency response and surveillance and response measures. I think this is a very important initiative, and it gives me immense pleasure to be part of this collaborative activity, wherein the National Center for National Institute of Disaster Management, NIDM, and CDC have come together with NCDC experts who impart a sort of an overview of the current pandemic scenario, surveillance activities which have been undertaken right from the beginning, and how the scenario has changed with the implementation of those public health activities in the past 2 years. Has been a really very, very challenging scenario from all the public health aspects, whatever we can imagine. So I will not dwell on the COVID-19 pandemic, but to begin with, I would like to highlight that India has witnessed a large number of pandemics, particularly biological threats, which have led gradually to epidemic situation, outbreak situation, and also we have seen that there have been 4 pandemics, the public health emergencies of international concern, starting from H1N1, then going on to Ebola, then going on to Zika, and now we are also dealing with the COVID-19 pandemic. So these have been the public health emergencies of international concern, which have drawn attention in many countries in the world, including India. We have also seen there have been several public health threats inside the country, where the events were definitely unexpected and having a severe impact on the morbidity and mortality. I would like to highlight in this regard the Nipah virus outbreaks, 2 outbreaks which have occurred in the state of Kerala, where it was least expected. And then to add with it, we have the complex scenario of AES syndrome. Year by year, we are having AES outbreaks in the various districts of Bihar. And I know that we have faced this challenge with multi-pronged approach, but still a lot needs to be done to ensure that our country's population is protected or is having a fairly good level of surveillance system where we can detect early warning signs at an appropriate time, and our approach have to be proactive in nature. And to have a proactive approach, it is very, very important that preparedness is strengthened at all levels. I'd like to highlight that NCDC have been at the forefront as far as COVID-19 pandemic is concerned, as far as Nipah virus outbreak is concerned, or if we even if the outbreaks like Zika, which has been seen, which started from Gujarat and then went on to Rajasthan, Madhya Pradesh, Tamil Nadu, and recently of late we have seen that the outbreak of Zika virus was noted in the Trivandrum district of Kerala and thereafter in the Kanpur district of Uttar Pradesh, and few other districts were also got affected. So we all are very, very clear that these pandemics, particularly zoonotic threats, are going to be there for the times to come. And as WHO has already warned the globe that the future outbreaks which are likely to be zoonotic in origin could be to the magnitude of 75% of the total pandemics which the world is likely to face in future. So we have to have a clear capacity building across all the sectors with a one health approach, dealing with all hazards in a very, very planned manner. And in this line, importance of this particular webinar series is really very, very important. And here I will also like to mention that NCDC has already been in the forefront, and we have submitted proposal, and I would like to highlight our Honorable Prime Minister's kind gesture and for enhancing the surveillance capacity. He has at the right time given us a big package wherein not only the surveillance system in the routine districts or in the normal districts of the country has been focused, but also the surveillance in the metropolitan cities has been given a big push by sanctioning 20 metropolitan surveillance units. And NCDC branches which were approved or which were being established in the various states have further been given another decentralized push by approval of the 5 regional NCDC centers. So these are the initiatives which take us to the future. And apart from this, there has been a significant push as far as NCDC divisions are concerned at the headquarters. And in this line, I would like to mention 3-4 important initiatives which have been taken in the recent 2 years. Number one, COVAS 1900 6800 which enhanced the RT-PCR capacity to a substantial level. Then the gene sequencing, INSACOG network, which have been established. Currently, it has got around 52 labs. And this INSACOG network, we all know that has supported the world with a great amount of genome sequencing at the right time, at the right place. And we are having regular genomic monitoring so that the variants of concern, new mutations which are detected at time. And currently, I must mention that our INSACOG network has also detected the new type of variant where we are seeing BA1 and BA2 mixture, like Delta Omicron, which is also in news, but very few cases of those are being reported from the country. But still, we know that the way in which this pandemic has behaved in past gives us a really alarm that we have to see all the variants which are suspicion, and we have to correlate the genomic part with the public health part. And here lies the importance of NCDC being the nodal agency for INSACOG, that whatever genomic experts tell us, we need to put in place our systems in place so that we can have appropriate response through our emergency operation center. We have to develop a chain of emergency operation center so that not only the surveillance is strengthened, but also incident management system is also strengthened. So I would like to mention that NCDC is taking epidemiological intelligence services course, 3x3 frontline epidemiological services course, and is also taking various other FETPs in coordination with the technical expertise and technical support from CDC. So I'll not take much of your time because I know that the sessions in this webinar have been very, very carefully planned. And in this line, I will mention that the epidemiological skills are the prime importance. We have to see all the parameters from epidemiological intelligence angle. Your data is one part, but for interpreting data in a very, very careful manner, you require epidemiological intelligence, and you require the data to use it in a very intelligent manner so that your conclusions or your interpretations give us a policy direction, give us the policy direction to the program manager people, and there lies the importance of developing capacity across the country. And here this online training, I will again congratulate the organizers in this big initiative, and our NCDC experts are with the team, and we will be definitely taking it further down to the grassroots level where really the action matters. So I'll stop here, and I wish all the success to this particular important initiative, and we look forward for important deliberation. And at the end of the session, we'd like to have some kind of debriefing also, wherein we can have feedback also to improve our course for future. So thank you very much to the organizers for giving us this opportunity.
Thank you very much, sir, for your address and for providing glimpse of the work done to combat the pandemic, COVID-19 pandemic by Government of India across the country. And government has taken a multidimensional approach to tackle the onslaught of this COVID-19 pandemic, which resulted in stemming the onslaught of this pandemic in the country. And this holistic range of measures have been adopted to counter the challenges that is posed by this pandemic in the country. Before we conclude the session, Meghna ma'am, would you like to add something?
Actually, no, I was just going to say thank you again to also Dr. Singh. I was originally under the impression that Dr. Himanshu was going to join, so I was very pleasantly surprised. I just want to echo everything obviously that he said. We are very much excited about our collaboration on multiple fronts, including the field epidemiology training program moving forward, and also the feedback from these weekly webinar series is really what will make this a stronger platform moving forward. So thank you again.
Thank you very much, ma'am. Before moving to next session, I request all the panelists to kindly switch on their videos so that we can take group photographs. I once again request all the panelists to kindly switch on their videos. Okay, thank you, everyone. So now moving along to our technical session. Before we get started, participants are humbly requested to make the session interactive by raising queries to our experts. So there will be 4 presentations in the technical session. And for the first presentation, I pass on the stage to Dr. Rajiv Sharma, who is PHS Lead Emergency Management, CDC India. Over to you, sir.
Thank you, Anilji, and good afternoon, good evening, good morning, everyone, wherever you are, and namaste. And if you let me to share my slide.
Yes, sir, you have privilege to share your slide.
कौन सा आजू? You are like, हाँ ये. Yeah. Anilji, can you see my slide?
Yes, sir, your PowerPoint is visible.
Thank you. I hope we had a very good and informative and enlightening inaugural session. So with that, we'll start with the technical session. And thank you, Anil, and all the participants as well as panelists. The topic is COVID-19 pandemic response and management in India. So it's a huge and vast topic. As we have other panelists who will cover, broader part of the response, preparedness, as well resources available for this COVID-19 management. So I will just, briefly focus on how we have been collaborating with various institutions, multi-layer, multi-sectoral, or multi-ministerial, as Dr. Meghna Desai Country Director CDC India has already given a brief overview. So in that line, I will just add some more information. The pandemic threat is constant, unpredictable, but inevitable and costly, and we are all aware this part. We all are vulnerable and prone to health emergencies and disaster due to the re-emergence and emergence of new diseases and changing climate conditions, as Director NCDC was, nicely mentioning on those new evidences which he has mentioned recently. We are still in a response and management of COVID-19. This webinar series is a timely program to visualize what went well, what went less well, and future preparedness that needs to be undertaken. The webinar series would be directed towards sensitization, institutionalization, promotion of exchange of information, knowledge, and innovation among participants to enhance the public health, emergency, disaster preparedness and response capabilities. In addition to skill development, the webinar will also help in promoting the use of the Public Health Emergency Operations Center, Emergency Operations Center, Strategic Health Operations Center, Control Room, War Room, and application of incident response system as well as incident management system for a coordinated response. Why emergency response capacity building is required? What are the triggers which gives a way to rapidly enhance the capacity? The surge of the COVID-19 cases, in the past, different surge, we have seen that COVID-19 pandemic came with a sudden rise of cases, and any health emergency and disaster are, almost unpredictable, which made preparedness most important. And there will continue to be a large increase in signals, events, and resource requests, deliveries, and deployments, which will pose great challenges to maintaining oversight and keeping track of public health actions within an overstressed and limited workforce context. And we have seen Government of India has taken and is taking all necessary steps for developing the capacity to be prepared well to face any surge of the cases. And how could COVID-19 pandemic play out? What we are thinking, it's a this question with the scientists, the researchers, as well as the public and community. There are various ways, playing out with this pandemic. The virus becomes endemic and countries live with the virus, or a variant evolves that trigger a new pandemic within the current COVID-19 pandemic. So there are various theories, to living with or to moving with this pandemic. Public Health Emergency Management Professional Development Program, which Dr. Meghna was also mentioning, the context is the COVID-19 pandemic taught many lessons. Perhaps one of the most prevalent weakness was the constant challenge of coordination, collaboration, and communication. And this has been evidence in many countries that highly intelligent leaders and workers with exemplary skills, but the coordination of various stakeholders, multi-sectoral, multi-ministerial, kept breaking down. Both progress and efficiency suffered as a consequence. In contrast, countries having robust coordination system and using, incident response system, incident management system, resulted in a better management of the pandemic. The guiding concept of public health emergency management professional development program are based on modern emergency management principles such as incident response system, incident management system, and this is a globally accepted management system to respond to and mitigate the effect of emergencies. And PNPDB is a key pillar for pandemic preparedness. One of the key deliverables of the fourth Indo-US Health Dialogue 2021 is an agreement to work on pandemic preparedness and the signing of an memorandum of understanding between the Ministry of Health and Family Welfare and the Human and Health Services Government of United States is one of a step in this direction. The government of India already, acknowledged and done the need for a sustainable, resilient public health infrastructure and program. And the Prime Minister Ayushman Bharat Health Infrastructure Mission, PM Abhim, highlights that. And PM Abhim focuses on strengthening national public health institution, expanding the integrated health information portal, operationalization of the several public health units, establishment of public health emergency operation center. So all this is, one of the biggest focus on developing a resilient health infrastructure for pandemic management. The FEMPDP, NCDC, CDC entered into an agreement, before starting Epidemic Intelligence Service Program or EPTP. So this was an agreement in 2011 by signing and launched first ever India EIS program, Epidemic Intelligence Service Program in 2012. And Director NCDC was also, highlighting the success of this program. Consequently, the program expanded to National Institute of Epidemiology, Chennai and WHO country office to match the need. However, this has been further extended to include, basic and intermediate level of courses, develop a 3-tiered FPTP. And following this successful model and lesson learned from the FPTP will definitely going to help our FEMPDP. And FEMPDP will institutionalize public health emergency and disaster management principles, use or application of IRS, IMS to develop functional ability of emergency operation centers, control room, war room at the national, state and public health institution level. And also responding and managing public health emergencies more effectively. India, could be a pioneer and leader in FEMPDP for Southeast Asia countries and could develop a center of excellence in FEM for the region. And FEM principles and IMS application develop processes that provide a standardized approach to guiding the lead agency to best use of expertise, information and resources of multi-sectoral, multi-layered partners and to work in a coordinated manner for pandemic and outbreak response. These are the essential elements of public health emergency management. We always say 3S: staff, staff, and system. So staffing and human resource and trained human resource is one of the key functional element of any public health response. So in this direction, NCDC and NIDM, both are the lead agency building the capacity. And coming back on the system part, plan, policies and procedures and pre-established plan, procedure, protocols describing how your emergency operation center or strategic health operation center will operate is very effective, one way of developing the plan and use of the plan if you have a trained staff. And coming back on the infrastructure part, the step part, the facility which serve as the, like shock or control room or PHUC. And this is necessary for, use of the equipment, technology, displaying, as well as developing a dashboard. For achieving all the objective of staff, step and system and commitment and a willingness from the leadership or policy level or political level is a paramount. Like the tier approach in FETP, basic, intermediate, and advanced level, and following this model, a 3-tiered training program on public health emergency management has been developed with the experience developing and implementation of FETP, and NCDC, may act as a focal point for such training, especially for the FEMPDP. This is the 3-tier. We in public health emergency management we say 3-tier plus institutional capacity building. Why 3 plus? The one more tier added here is the sensitization of the community as well as sensitization of the policy makers, like at the strategic level. So in order to strengthen the above 3-tier institutional capacity, it is important and necessary also to sensitize leadership at the strategic level, at the state as well as the national level. CDC working closely with the NCDC and NIDM building this capacity. So one of the takeaway from this collaboration is, we have been supporting Strategic Health Operations Center, NCDC, as well as Public Health Emergency Operations Center in Tamil Nadu, Field UC, which earlier also mentioned that, which during Kumbh Mela, NCDC, CDC, and WHO collaboration supported that establishment. During the second surge of COVID-19 in India, there was a great need for rapid capacity development for rapid response team. NCDC and CDC supported WHO India in the development of an online self-learning package for rapid response team in context of COVID-19, which is available in open WHO hub, as well as Swasti Gurukul for global access. As of date, over 5,000 learners have already benefited from this online learning portal or online RRT training. This is the one of the successful model of the policy intervention for rapid response team training, which Director NCDC has sent this communication to all the state surveillance unit, and with that, the increase of conducting or means replicating or cascading this training in many states happen. This is one of the technical support with concerned central, state, and district administration in technical collaboration to the established field DOC, which is in Haridwar 2021, one of the model we supported. Despite previous Kumbh Melas like Nasik, Ujjain, and Prayagraj, this one very important in context of the COVID-19. And this is just one glimpse of the pictures from this, and this is a recognition from the government of Uttarakhand for NCDC, CDC support, and ending with the, we have recently supported and partnered with the MHA institution and WHO to host a special technical session on public health preparedness and response in World Congress on Disaster Management, which was in New Delhi. And this is the now weekly webinar series. Here we are for this. Thank you, and thank you, Anilji. Over to you.
Thank you very much, sir, for your insightful talk. And indeed, this is right time where we need to discuss the past, we need to discuss the present as well as the future projections. And this groundwork will definitely aid in our preparedness against such pandemic like COVID-19, and it will also strengthen our strategies to avoid or at least to minimize the losses. So, sir, as I can see, there is no query by our participant, but if there will be any, we will be sharing with you. So thank you very much, sir, for your presentation. Moving to next presentation. For the second presentation, we have with us Dr. Himanshu Chauhan. Sir is Joint Director and Officer in Charge in IDSP and CDC Government of India. Over to you, sir.
Thank you very much, Anilji. A very good afternoon to all the respected seniors who are connected, senior colleagues, my own CSU colleagues, colleagues from IDSP, DSU, and other professional colleagues. So I thank the organizers for providing us this opportunity to share the disease surveillance and response perspective to public health emergency management and response. So if I may just quickly share my slideshow. Yeah, I hope it is visible, and I'm just—
Yes, sir, your PPT is visible.
Right. Thank you very much. So the topic that was assigned to IDSP was to talk about disease surveillance and response. I've tried to build this presentation around the COVID-19 pandemic that we are currently into. I must not say that we just dealt with. It's still on, and what are the future directions that the program is headed to? So just to give a quick background of IDSP, the outbreaks during the 90s, especially the cholera outbreak of Delhi and the plague outbreak of Surat, these major outbreaks and many others, they necessitated a surveillance and response system. And thus, the National Surveillance Program for Communicable Diseases was launched in 1997-98. Ultimately, that took the shape of or evolved into the Integrated Disease Surveillance Program, which was initially with the World Bank support, and then gradually it was 100% domestically funded program under the National Health Mission since 2012. And moving ahead in 2021, the reporting of IDSP has been transitioned to Integrated Health Information Platform, which I'll be talking about in slightly more details. The mission of the program is to detect the early warning signals of impending outbreak of selected communicable diseases. And therefore, when COVID-19 struck, it was but logical that IDSP, it is the core mandate of IDSP to respond to any outbreak. And this was one of the largest, I would not say one of, but the largest outbreak that IDSP had witnessed during its 2.5 decades of existence. Initiation of timely and effective public health actions is another mandate of the program, and that requires creation of trained cadre of responders at the district, state, and national levels, which are labeled as the rapid response teams under IDSP. And ultimately, this should all be targeted towards reducing mortality and morbidity due to communicable disease outbreaks. So the system currently IDSP in its original form was designed to collect data from 3 levels, that is ANMs collecting the syndromic data, the presumptive data being fed in by the doctors who are examining the cases, and then ultimately the lab confirmed diagnosis by the laboratories. Just to give an overview, a snapshot of what is the profile of conditions that IDSP IHIP is currently responsible for. So surveillance of syndromes, which practically capture every possible outbreak-prone disease that the country has faced in the past and is likely based on our current understanding of the disease scenario. And the presumptive diagnosis, which come from the health facilities, wherein the case has been slightly examined in slightly more detailed manner, and then ultimately the labs are confirming certain diagnosis. So zoonotic diseases form a bulk of the conditions that are under surveillance, and we know that most of the threats are zoonotic in origin. Just to give a snapshot of the major achievements of IDSP, it has created a nationwide surveillance and response network with dedicated resources at the national, state, and district level for outbreaks, for responding to outbreaks, detecting and responding to outbreaks. A central surveillance unit with 36 state surveillance units and 733 district surveillance units indicates that there is a system in place right up to the district level with dedicated resources who are trained, whose capacity has been built to detect and respond to outbreaks in the incipient stage. This also calls for having a public health lab network. So under the program, 397 district level public health labs have been sanctioned, and 322 are currently functional. There's also a network of state level laboratories, the state referral laboratories, which the program permits for. These are essentially medical college labs, which support outbreak investigation, the districts and the states. Detection and response to diseases of public health importance like Zika, Nipah, CCHF, KFD, practically every major outbreak that has happened, IDSP's mandate calls for involvement of IDSP in these outbreaks. We also have established a robust event-based surveillance system, which is the media scanning and verification cell. And it is gradually evolving. We are utilizing the latest developments in AI and automation, machine learning, etc., to enhance this further. IDSP has been involved in implementation of contingency plan for every single avian influenza outbreak in the country. So at the district level, the IDSP is the core team which is responsible for implementing the contingency plan. Till date, till the last outbreak report was published and put in public domain, a total of 20,038 outbreaks had been detected and responded to in its history. The contributions of IDSP have been recognized and lauded time to time by the country's leadership. Just a snapshot of what we did. IDSP during COVID-19, this isn't the core of today's presentation, but as it was the mandate of IDSP, so it was a natural fit. And we supported the surveillance of international travelers in the initial phase. The quarantine operations were the bulk of our work that we did. Initially, there were only 2 or 3 labs that were testing samples. So having samples from all over the country sent across to these 2 or 3 labs called for coordination, which was carried out by IDSP. Community surveillance was our core area. Initially, we had 14 days of home quarantine followed by 14 days of self-health monitoring. So essentially, people were under quarantine and followed for a period of almost a month. So immense work was carried out during that phase, especially around the second wave. Contact tracing was another resource-consuming operation. So we had till the last count that we were monitoring it, more than around 5 crore contacts were traced and put under surveillance. Active case search operations in the containment zones, establishment of containment zones, decontainment, and all those operations. Super spreader events were handled by the IDSP teams at state and district level, supported by the national level. Data for action, all the data that practically came from the district level was routed through the IDSP system. And most of the action that was framed, that was initiated, was based on this data. Framing of guidelines, SOPs was another important task that was carried out. And Director Sir also mentioned about the central role of NCDC IDSP in whole genome sequencing activities as the hub of INSACOG. The important lessons learned from the COVID-19 response and even responding to the earlier outbreaks was that preparedness and response systems, they need to be strengthened before an event occurs. There were some systems put in place. We hit the ground running in the case of COVID-19, and therefore many systems were put in place as the pandemic unfolded. So if these systems are put in place before and they can be strengthened, that is something which is desirable. Investments in public health systems, this is a global lesson learned by most countries that this yields rich dividends. The basic principles of risk assessment and communication, although they may sound simple, they are difficult to implement. This is what the COVID-19 pandemic taught us. And in a complex pandemic like COVID-19, there are multiple agencies and sources of data. So discrepancies they would be there. They are bound to be there. So discrepancies in data, they need to be acknowledged rather than reconciled. There can never be, so as to say, a single source which can give the complete picture. A command and control structure or an emergency operations center, irrespective of the terminology used, it definitely helps in coordinating a multi-agency response. We have seen many states utilizing this concept and using EOCs or command and control structures to respond, and their response has been acknowledged and lauded nationally as well as internationally. And most importantly, documentation of best practices and lessons learned is vital. Within a couple of years, probably as COVID-19 heads towards becoming an endemic condition, many of the lessons learned would be lost or would be just relegated to memory. So it is important that these are just captured and documented. So as I said in my initial slides, the IDSP is gradually transitioning into a newer surveillance system, which is the Integrated Health Information Platform. This is a real-time case-based information platform which has integrated analytics, AI tools can be integrated, advanced visualization capabilities, and many features that the newer technology offers. So IDSP has been migrated onto IHIP, the data reporting part of it. And the long-term vision is that all national health programs are to be placed on IHIP, which is also in sync with the vision of the National Digital Health Mission. So this is a thematic slide showing that it offers integration of data from multiple sources and creating a larger picture which can be utilized by policymakers and decision makers. So the key differences between IDSP and IHIP, I would not go into the detail, but from a paper-based weekly reporting system, which was targeting 18 health conditions, we move on to an electronic data collection and transmission system with daily surveillance reporting and capturing some 33 plus health conditions, and it is case-based. So just to give a quick snapshot of take you through IHIP platform, the IDSP is already there. There are other national health programs which are likely to be placed soon. It provides a screen for all the users, right from the national level to the ANM with role-based user access. So if I'm supposed to do data entry, I only get to see the data entry part. If I'm supposed to analyze, I just look at the analytical dashboards. There are various formats which are used by different users like the S form, P form, and L form. The S form, we have also started capturing deaths recently with the IHIP migration. It permits both mobile-based, mobile app-based data entry as well as a web login and a traditional computer-based data entry system. So all intuitive drop-down menus so as to make the task of the person who is doing the data entry simple and intuitive. We also have the output. This is the input. The left-hand side of the slide shows the input arm that the various data entry forms, and the output can be seen in the form of the various dashboards, which provide an integrated auto-analyzed report. So as we can see that from 21st March onwards, the week ending in 27th March, some 571,000 cases of syndromic surveillance have been entered onto the system by the ANMs, and 720 deaths have been captured during this 1 week. And similarly, the P form and the L form. And yet we are to completely migrate about 10 large states. So this, once that happens, this data would be very robust, and this would be very quality data which can be used for making decisions. We also can see the heat maps, like in this case, we are able to see KFD in Karnataka in the last 1 month, and we see where those cases are clustered. Each one of them, each bubble is a clickable action item, and we can download the line list of each of these cases. You can see here which PHC, which area these cases belong to. So an excellent use of case-based surveillance system and translating into maps and visualizations, which can be utilized by decision makers. So to summarize, and before I stop, we are in a transition stage. Most of the states have been migrated onto the newer system for IDSP reporting. There would be a few challenges that we anticipate in the remaining lot of states, but then efforts are on to address those challenges at the highest level. And once the system is put in place, we'll have India would be the first country in the world to have such a disease surveillance, such a unique disease surveillance program, which offers all these utilities embedded into it. And we can serve as a role model for the world to follow this. So I'll stop here. Thank you very much.
Thank you very much, sir, for enriching our knowledge apropos of integrated disease surveillance program, which is one of the major national health program under National Health Mission, with aim to strengthen and maintain decentralized laboratory-based IT-enabled disease surveillance system and to respond to outbreaks in early rising phases. And as you also highlighted that we need to document the learning of this COVID-19 pandemic response. As our Honorable Prime Minister in his 10-point agenda on disaster risk management, he also highlighted that the opportunity to learn from the disaster, it should not be wasted. And this learning will help us to build our strategies for better management of such emergencies in the future. So thank you very much, sir. Sir, there is one query raised by our participant, and this query is from Mr. Padma Singh, and his query is that how the authenticity of the entered data is ensured.
So the authenticity of the entered data. So as we know, even in IDSP, there was a system of monitoring at the district level. Now that the district surveillance units are freed from the task of collecting and entering the data, their resources, their time and energy can be diverted towards monitoring. So this system permits for authentication and cross verification right at the stage of data entry. So before the data generator he feeds in the data and submits, there is a cross verification saying that this data is about to be submitted to the national portal. Are you sure you want to submit this data? And the next level immediately gets alerted. So suppose it's the ANM, the PHC medical officer gets alerted about the data entered. So there is a scope of monitoring that data and to see if there are any discrepancies or any wrong data elements entered into the system, and that can also be corrected. So multiple levels of monitoring and supervision, and as it becomes more widely used, the users would also be more comfortable with doing the correct type of data entry and less of error prone is going to happen.
Thank you very much, sir, for answering the query of our participant. That was the only query raised by our participant. And once again, thank you very much, sir, for sparing your time and joining us. Thank you very much. Now moving to the next presentation. For the next talk, we have with us Professor Surya Prakash. Sir is Head GMR and CVR Division in National Institute of Disaster Management, Ministry of Home Affairs, Government of India. So with these words, I pass on the stage to you, sir. Over to you, sir.
Thank you, Anilji. Am I audible?
Yes, sir, you are audible.
Okay. First of all, let me thank our dignitaries who speak in the inaugural program and pointed out very significant concerns related to pandemics, public health emergencies, and climate change related health issues. Meghna Desai ji, Sujit Singh ji, and Dr. Himanshu Chauhan also highlighted the initiatives taken by CDC India and also NCDC, as well as Ministry of Health and Family Welfare, Government of India. I would also like to add here that the Ministry of Home Affairs, which is the nodal ministry on disaster management, had also taken up certain initiatives with respect to the current COVID-19 situation. And at the time when it was actually happening, the government of India was actually seriously thinking about the provisions to contain this disease. So a lot of restrictions were to be imposed, which was not possible without the enactment of the various provisions under the Disaster Management Act 2005. So we utilized the provisions and sections of Epidemics Disease Act in 1897 and also the section 51 to 60 in the Disaster Management Act 2005. Besides that, a lot of other issues had also risen during the COVID-19 handling. I remember we were part of the interministerial central teams, which went to the hotspots where the cases were rising. And many of the cases we found that at times, even the health workers, including the doctors and the paramedics, they were actually being attacked by some of the antisocial elements. At that time, Government of India took up another initiative and passed another ordinance, Epidemics Disease Ordinance in 2020, to provide them safety measures. So these were the main actions which were initiated jointly by Ministry of Health and Family Welfare and Ministry of Home Affairs. As part of the mandates under the Disaster Management Act and being the chair of National Executive Committee for Disaster Management, the Home Secretary, he actually empowered the Secretary Ministry of Health and Family Welfare to utilize the powers deliberated to the chair of the National Executive Committee on Disaster Management under the provisions of Disaster Management Act. These are some of the issues which we need to learn, that whenever we are trying to actually develop a new system or regulate certain activities in order to contain the diseases or the ill impacts of any climate variabilities on the human beings we have to consider such strict measures which will actually contain the disease. Besides that, a lot of other issues were also taken up, and we found them very much interconnected to each other. So the COVID-19, actually, we had a cyclone. If you remember, in May 2020, we had the Amphan cyclone in the West Bengal state, which affected many areas and the communities. At that time, even our disaster management forces, they had to adapt to the new mechanisms and styles of such rescue, relief, and also rehabilitation measures. And this was a challenge to even the DM authorities at the district levels and the state levels. So a lot of new challenges had come up when we were trying to even utilize our rehabilitation shelters for the cyclone impacts. Even there also the management practices for putting up the victims of the cyclone together, and also trying to manage the impacts of the COVID-19 also to stop its spread in those situations. So there have been several type of challenges, systemic risks, and both the biological as well as the hydrometeorological hazards combining together and affecting our communities. So that's why in the inaugural, I actually made a request to add climate change adaptation also along with the pandemics, public health emergencies, and disaster management. And we need to build partnerships among all these organizations together. Now the heat waves are coming up. Already IMD has declared in some of the states the likelihood of the heat waves, and these heat waves will also cause some of the health hazards which also need to be taken care. Then not only India, other countries had also faced the similar events. Some of them faced floods, some of them faced droughts, and some of them faced forest fires and other type of disaster. I remember when on 7th February 2021, we had faced actually a major landslide along with the breaching of a glacier body in the Joshimath block of Chamoli district in Uttarakhand state. Again, the measures which were to be adopted were very different from our usual processes and procedures. As said by Dr. Rajiv Sharma, we always have some kind of uncertainties which result into major disaster situations. We cannot eliminate sometimes those uncertainties, so they are likely to happen. But we can always prepare a response plan and a preparedness plan against such disasters. So making those invisible and potential or emerging disasters as visible ones, and then preparing against them. And while preparing, the community's involvement is very much important. And that's where the role of public health emergencies departments will also come. Because until and unless all citizens are made aware, informed, and prepared against such risks, it will not be possible to handle the challenges of the widespread impacts of these kind of health hazards. So not only in terms of hazard reduction, but also exposure of our communities. Because nowadays India actually succeeded over the last 2 years in containing the impacts of the COVID-19 compared to many of the other countries, even comparable to the developed countries, because of our strict measures which we took and follow-up of a COVID-appropriate behavior by our masses at large, and also the support from the media in making this information available to all concerned stakeholders as well as the communities. So this is what is important. Now with the opening, we have felt that whatever people are likely to do now in terms of their workmanships, that as a workforce in their official environments or institutional environments or the industries, they need to actually follow certain measures so that the disease can be actually eradicated or at least minimized in the office and environments and the domestic environments wherever they live, go or work. So that's why these kind of webinars have been planned as part of the beyond COVID-19 activities, because we says that now we are moving beyond the COVID situations, but we should remain careful and cautious in terms of any other such pandemics likely to happen or emerge. As said by our Dr. Sujit Singh ji, as a resource person in the inaugural program, that we had already witnessed in the past also several other pandemics. So new pandemics or the pandemics which happened in the past can also get reactivated or revived. So therefore, we have to be actually careful. So why my suggestions are that it's good that Dr. Chauhan told us that we are moving towards integrated health information platform, which will be actually digitizing all the information related to the health risks to our communities and to the individuals through a web platform, which will be available either through the computer systems or through the mobile apps. But then keeping records of all, even those who are traveling across the borders, be it the international borders or the state borders or the district borders, if the diseases are likely to spread. So even their data and records need to be maintained and managed so that we can trace them as we did in COVID-19, track them well, and also test and then treat them well. So these steps will continue as we have done in the past, and we will continue the best practices. And on the other hand, we have to actually get away from the bad practices. For example, there were many rumors, misinformations, which led to panic and chaos among the public. One of the example is the migration of the laborers from one state to the other states when they learned that the likelihoods of casualties are very much high, and therefore they started moving from one place to the other, and a lot of crowding took place at the railway stations and the bus stops, which resulted into concentration of population and also made our efforts to contain the disease difficult. So those kind of challenges will also be there and have to be considered. So I would say that we need not only consider these partnerships among the events like pandemics, public health emergencies, climate change, or disasters, but also making the masses as partners in our processes. So they have to be involved in our plans, policies, and other activities so that it becomes a plan by the people's participation. So that is very much important, or their partnership is very much important. So this is what I would like to suggest. And further that whatever other hazards are happening in these localities, so they also need to be integrated for a holistic approach. That is what I would suggest, that whenever we are dealing with health hazards, they are not happening in isolation. They can happen along with other disasters as secondary hazards, or they can also lead to other type of hazards within our communities. For example, the disease which is said to be zoonotic in nature, has come from the animals, can also get spread from humans to the livestock. And at times there were some cases which were reported even amongst the wildlife and livestock, which was again well contained. So the likelihoods of the spread of the health hazards from one biological entity to the other biological entities is also to be looked into for our ecosystem based disaster risk reduction and resilience approach. And that's what we have actually decided in the Sendai framework for disaster risk reduction and resilience during the Third World Conference on Disaster Risk Reduction from 14th to 18th March 2015 at Sendai in Japan. Lot of efforts have been made by National Institute of Disaster Management and National Disaster Management Authority also, where we had conducted lot of webinar series and also online training program, and currently we are also going with the physical training programs jointly with different partners including NCDC, MHFW, as well as our CDC India. So we have been doing these efforts together, and lot of seminars, more than 100 I think have already been conducted over the last 2 years. So this is what is being done at present. So finally, because time is short, I know there is another speaker on the line, so I'll just like to conclude that we have to do more investments for the health resilient systems, society and infrastructure, along with the services for protection, safety and protection of society, the human beings as well as our environment. We need to develop a comprehensive integrated framework, action plans and policies at all levels, be it at the grassroots level, from the decentralized process of PRIs and ULBs to district level or block levels, and up to the state and the national levels. We have, I'm just suggesting one acronym to go ahead with the integrated approach related to climate, health, economy, ecosystems. I give the word cheers. Cheers means we have to be happier with a good healthy system in our lifestyles. For that, cheers means climate, health, economy, ecosystem based resilience and sustenance. We are also talking about sustainable development goals for safety and protection of society, systems, services and infrastructure. So I would suggest that let's follow cheers, which is actually an acronym which I am driving based on sustainable developmental goals, the climate change agreements, and also the disaster management agreements at the global levels, along with our economic efforts and health sustenance in our societies and the individuals. So with these words, I would like to thank the organizer for providing me this opportunity, and wish you all the best. Thank you, Anilji. Back to you.
Thank you very much, sir, for sharing the perspective of Disaster Management Act 2005 in combating the COVID-19 pandemic in the country. This was the DM Act was the main weapon in the bucket of Government of India to tackle this public health emergency. And as you mentioned, we need to adopt an integrated approach to manage public health emergency and enhance disaster management capacities, as the need of hour is to go for a multi-hazard approach rather than tackling each emergency in silos. And we also need more investment in health system. As there is saying that health is wealth, so to protect this wealth, we need the investment in health system. So thank you very much, sir, for joining us and for enriching the knowledge of our participant. Sir, as I can see, there is no question raised by our participant, but if there will be any, we will be sharing with you.
Okay, thank you.
Thank you very much, sir. So coming to the last presentation, for the last talk of today's technical session, we have with us Dr. L. Swasti Charan. Sir is Director, EMR, Directorate General of Health Services, Government of India. The floor is yours, sir.
Can you please confirm whether you can see the slide?
Yes, sir. We can see your slide and you are audible as well.
Okay, thank you. I think many of the speakers have already dwelled into the various areas of the pandemic response and management in India. Like any other country, we have done our part, and my job here would be to summarize, consolidate different works, different tasks which has been carried out by various ministries in a government, all of government approach in India. And it is not entirely done by the Ministry of Health, not possibly by my division of emergency medical relief. To summarize some of the activities that we had, many of the activities that we have done here, I would like to present in the form of a schematic diagram. You know, it's a sometimes there's a trigger point, and then we say that through the IDSP alerts that we start having the surveillance of at the points of entry, either at the airport, the shipping, land borders, when we had the first wave of the pandemic starting from Wuhan in China. And we also, during that time, Dr. Himanshu has also, you know, said that there is already been community surveillance of for respiratory disease and other diseases under the IDSP. And we also have a logistic chain which is being maintained by the state government, central government, supporting it through various mechanisms like the National Health Mission. And we also have the laboratory testing capacity of various conditions, including zoonotic diseases. And the hospital preparedness has been an integral part of the preparedness as a whole. And then we have been training through various mechanisms, the risk communication to the public. And then we have been building the capacity of the various components of this system through various reasons. And when the pandemic arrived, and when we were trying to handle that, it was in these identified major areas where we tried to strengthen. Say, for example, the community surveillance through the disease surveillance network, with more emphasis on ILIs and the respiratory diseases, and then augmenting the PPEs, N95 and diagnostic reagents, and also early and timely sample testing through lab networks, etc. And then hospital preparedness in terms of the isolation beds, critical care management, infection prevention, etc. And also handling the media through the various mechanisms, and also training program at various points of time. So this was how, in brief, I'm trying to say how it had happened. It did not happen with just one ministry, say, for example, Ministry of Health doing it alone. The various speakers have already identified them. I'm trying to just list out some of those major activities, like, for example, the National Disaster Management Authority provided the overall framework with the Empower groups trying to do interministerial coordination, and the Department of Pharma were concentrating on monitoring of requirements of the PPE, masks, ventilators, and the factories for reducing essential items, etc. The civil aviation was also launching the Lifeline Uran for the cargo flights for supplying essential items to the various parts of the country after the initial evacuation of the Indians stuck overboard, like that kind of thing. The MEA also planned coordinated repatriation of Indians with the Vande Mataram, Vande Bharat mission, and they were also in sync with all the missions all across the world for procuring the pharmaceutical, the APIs, as well as the PPE kits, etc. So this was how some of these ministries were doing. And finally, we had the Ministry of Textiles also, trying to work on the quality and the quantity of PPEs, coverall, etc. And finally, we had the MIT was also setting up the also testing and the quantity of for the COVID-19 symptoms. And the Ayush Ministry also came up with the preventive healthcare side, and they also provided many of the guidelines for COVID-19 management based on the Ayurvedic, based on the Ayurveda and the yoga systems of medicine. The Ministry of MSME was also making make India self-sufficient in the sanitizer, bottle dispensers, and they contributed significantly in boosting domestic production of auxiliary items like masks, face shields, PPE kits, etc. And the Defense Ministry was also helping in evacuation of people, and in also the research and development of in the field of science and technology for providing adequate medical equipment, sanitizers, face masks, etc. And so with this background, many speakers before me had already highlighted many of them. So this this pandemic has already tested many things in the system. We used to say that it has come to test at the individual level, the system of the individual, the immunity, the defense mechanisms, and the vulnerabilities in terms of risk factors or the comorbid condition. The COVID virus has already done that. At the same time, it has also tested the health system, and we have learned it in many ways. We have learned by facing the pandemic squarely, and this has given us a very good road ahead. And this is the message which I want to drive through during this ending part of the webinar. So we have now adopting what is known as a five-fold approach of testing, tracking, treating, vaccinating, and the COVID appropriate behavior. So we continue to do this, and we also ensure that there is sufficient testing infrastructure to support the test component, and the intensive containment and graded restriction relaxation in districts with high weekly case positivity or the bed occupancy in terms of oxygen beds and ICU beds, etc., for treating those COVID-19 patients. And we also have learned that we need to upgrade the health infrastructure in terms of the isolation wards, oxygen beds or the ICU beds, the ventilators, the transport ambulances, the advanced life support ambulances, along with the logistics and the trucks. And we have also learned that it is high time that we also concentrate on creating and redesigning COVID-dedicated healthcare infrastructure in peri-urban, rural, and the tribal areas, including for those pediatric cases. So these were some of those learnings that we have had. Then the component of the PSA plans for providing continuous oxygen has also been a focus area, and India has really achieved a lot in this area as well. And ensuring effective usage of the ventilator. The ventilators may have been distributed through many of the schemes of the ministry, but then if you don't have the trained manpower, especially at the district hospital, many of the ventilators would stay unutilized, and then those patients who would be requiring ventilation would be crowding the tertiary care, compromising the quality. We also have learned that we need to continue to monitor the variants and other emerging evidences to modulate ongoing COVID management. And the vaccination drive has been a very success story for India. We need to focus more on the vaccine hesitancy, vaccine eagerness, and also the misconceptions related to vaccines, and ensuring vaccination of the priority age group as and when it is rolled out by the ministry is also one of the focus areas. And finally, the community ownership for adherence to COVID appropriate behavior remains the mainstay despite all the other components that we have highlighted. And my division here has been coordinating for many of the guidelines, especially guidelines for management asymptomatic mild and the severe cases of COVID has been coordinating in adults as well as in pediatric patients. And there was also the need for developing many of the post-COVID symptoms, guidelines for managing post-COVID symptoms. So we worked on with the teams of neurologists, nephrologists, and the gastrointestinal experts, the psychiatrists, and the mental health groups, as well as the cardiac and the cardiological groups, and have worked on all possible areas where the post-COVID symptoms need to be managed. And we have also released many of these guidelines. This is a continuous effort, and it is very difficult to summarize what the country has done in about 5-10 minutes. And I think many of the speakers have already highlighted the details of the statistics. I just wanted to concentrate on many of those ideas for what the COVID pandemic has taught us, and where we are now, and how we are prepared for any future pandemic, if at all this should come in future. But I would like to emphasize here that we also be gearing up together, cooperating with each other, intra-country as well as inter-countries, so that we make sure that this pandemic that we are seeing now, we are going through now, is the last pandemic that the human civilization face. With these words, I thank you for inviting me for this webinar. Thank you.
Thank you very much, sir, for your crisp presentation and sharing a road ahead for five-fold approach of test, track, treat, vaccinate, and COVID-19 appropriate behavior. Sir, there is one query raised by the participant. Just a second. And this query is from Ms. Mansi Tejpal, and his query is, since zoonotic disease constitute a major chunk of epidemiological threat, is there any work being done with animal husbandry and farming, especially since India is rapidly increasing its meat consumption as its GDP rises?
Yeah, that's a very good question, Mansi. And we all should understand the One Health concept. And I would like to inform here that the DGHS chairs a meeting, what is known as the Joint Monitoring Group. And say, for example, the zoonotic disease, especially for in terms of avian influenza, etc. We try to coordinate with the Department of Animal Husbandry. They are members of that particular meeting. And if there is any alert from the Animal Husbandry or from the IDSP, the DGHS chairs a meeting, and our division, coordinate with different organizations, including NCDC, UDCP, and the Ministry of Animal Husbandry to launch a joint approach along with the state government. So this is a very important thing, and we do that.
Thank you very much, sir. That was the only query from the participant. And once again, thank you very much for sparing your valuable time, pausing your busy schedule, and for enlightening us. Thank you very much. So that's all for the technical session. And I once again remind you all that today this is the maiden webinar of 12 webinar series on public health emergency and disaster management during and beyond COVID-19, building resilient workforce system infrastructure in India. And from today and since for every Wednesday, the webinar will be conducted for next 12 weeks. There is a marathon of efforts, consultation were carried out to frame this webinar series so that we can cover the topics related to public health emergencies, preparedness, response in the context of this COVID-19 pandemic and beyond, including the initiatives of the government of India, such as Prime Minister's Ayushman Bharat Health Infrastructure Mission. So stay tuned every Wednesday for this series. And this is also to inform that our feedback suggestion form link is shared in the chat box. And I request each and every participant to kindly fill that form, shared us with your views or your ideas about the webinar series and what you people are expecting from this webinar series, and it will help us to save this webinar series so that you people can utilize more and more from this series. So now this is time to draw the curtain of this today's webinar on COVID-19 pandemic response and management in India. Like I said, this is the inaugural webinar of the webinar series. And before saying adios to all, I take this privilege to propose vote of thanks to our distinguished dignitaries, to our distinguished experts, as well as the participants of this webinar. And at the outset, I would like to thank Dr. Sujit K. Singh, Director, National Center for Disease Control, Government of India, Dr. Meghna Desai, Country Director, CDC, Country Office India, and Professor Surya Prakash, Head GMR Division and CPRN Division and IDM, for gracing the inaugural session of this maiden webinar of this 12 webinar series, and for their insightful deliberation that laid the foundation of this whole webinar series. And I also take opportunity to thank our eminent speakers, Dr. Rajiv Sharma, Dr. Himanshu Chauhan, Professor Surya Prakash, and Dr. L. C. Charan for providing us this opportunity to learn and to gain from their respective knowledge for their respective experiences and expertise. And I would also like to thank Dr. Sunil Kumar, DGHS, Government of India, and Shri Taj Hassan, IPS Executive Director and IDM, for their directions, for their supervisions in framing this webinar series. And of course, participants, thanks is also due to our participant for who joined us in this webinar and who actively participate in this the technical session of this webinar through their queries. And I also would like to thank my GMR team as well as the team from CDC India as this organization of such event, it always required a collective actions. So thank you very much, GMR and CDC team. And once again, I request all the participants, please do fill the form that is shared in the chat box, and do let us know your suggestions, your feedback, and your recommendations for this webinar series. So we will wait for 5 more minutes, so that each get the opportunity to fill that forms. After that, we will be closing our webinar. So thank you each and everyone.